Yo guys, what's up? It's Ben here. Doing an update for you guys. I've got a little co-star today. I hope you don't mind. This is Little Comet. Um, he's about to do a poo probably, but anyway. Good news. I have got a surgery date. Woo! Good news, awesome Franken news. So, oh yeah, okay. If you've seen my last vlog before this, I had a letter from Plymouth Hospital saying that they've now got a wing, like they've now got the means to do top surgery, and I wanted Brighton obviously because it's nearer to me and it's easier all around. And so I wasn't sure where I was really in terms of what's going on. Am I going to be going to Plymouth now? Is it going to be a longer wait? So I hadn't heard back from anyone, and then randomly last week, excuse me, I got a phone call on my mobile from secretary, I guess, from a Brighton hospital offering me a surgery date on the 9th of January with Dr. Yelland, which, yeah, I'm chuffed, I'm over the moon. All the adjectives, is it adjective or a noun? I don't know, I didn't do well in English, but all the good things, all the good things, you're doing a poo, aren't you? Okay, that's what you think. On the 21st of December, I've got to go for like a consultation, just sort of going over everything, and I guess a one-to-one with Dr. Yelland, and yeah, just sort of paperwork and that sort of thing. I'm guessing by the sounds of it, I'll go a bit more into the letters in a minute. Yeah, so that's awesome. That's great news. I don't. The surgery's not that early, but I got to check in at 7:30 on the day of the surgery, so that means I'm going to have to spend an overnight in Brighton, which isn't a problem really. I can do that, but obviously I'll have to work something out with family or whoever's coming. Still don't know yet, but there's still time to work that sort of stuff out. Um, yeah, and I sort of just need to speak to some other guys because if it's an early surgery, I don't know whether I'll be out the same day. Because obviously, if I'm not out the same day, it might not be worth someone coming on that day because I don't want it to be a wasted trip for any of my family or anything. So yeah, we'll just have to see, try and find out more from that if I can. If anyone watching this has already had their surgery and they had an earlier appointment, did you get out the same day? Obviously, minus no complications or anything like that. Was it a few hours? I don't know. I'm guessing if I've got the really early, so if I check in 7:30, let's say 10 between 10 and 12 maybe, if I'm lucky, is operation time. Yeah, I don't know. It's so hard to call. So that's something I definitely need to ask about. Um, and my initial assessment sort of thing on the 21st. That's a 9 o'clock appointment. I won't stay overnight for that one, but I mean, I'm gonna try and get it a bit later because it takes a couple of hours probably from where I am to get to Brighton. So yeah, so I'll try and get a bit of a later time for that because that's just a bit of a pain up the arse. But obviously, if there's nothing, there's nothing. And yeah, and for the 9th of January, I'll probably arrange to I'll stay over on the 8th, make a little mini holiday of it, I guess. And yeah, try and work out whether I need to, whether I'll be gone on the 9th or on the 10th. So it's kind of hard to tell at the moment. So yeah, it's just saying there's a post-operative appointment usually scheduled 7 to 10 days after, which I sort of knew was happening anyway. So I've got to go to that. So yeah, it's just basically there's a do's and a don'ts list regarding the surgery. Do not sunbathe 1 week. No smoking. Obviously, I quit smoking like pretty much 3.5 years ago. Maybe I've had 3 cheeky ones, counting in between them, but that's the last one about a year ago, probably. Unless, yeah. Yes, the smoking doesn't apply. Do not have anything to eat or drink for at least 6 hours before surgery. Anything by mouth, including chewing gum, could cancel or postpone your surgery. So I have to inquire about that because I take medication in the morning, um, and I need a bit of water for that. But water's usually okay. I think they mean like alcoholic and fizzy and that sort of thing. Do's: tell us any medication you're taking. The morning or evening prior to surgery, you are requested to wash your hair and take a shower. Smell it. Arrange for transport to and from the hospital. Perhaps include a pillow and blanket in the car for your comfort post-operatively. So yeah, that's a one for whoever comes and gets me. Arrange for someone to stay with you at home for 24 hours after your surgery. Again, I haven't sorted that out yet, but there's like options with my sisters or my mum or whatever. Prepare for your return to your own home by A, removing any potential obstacles from bed to bathroom. That includes you. Choose your favourite magazines. I don't read magazines, but thank you. Or book for your bedside table. That's very specific. What if I don't want to read my favourite book? Gather extra pillows for comfort and or elevation. Remove nail polish, contact lenses, jewellery and all makeup whilst at home. Bring loose fitting, front opening and comfortable clothing. So that's, all sort of pretty standard stuff. Day of surgery. Please arrive at your specified admission time and make allowances for traffic delays. You will be admitted by a nurse who will assist you. Mr. Yelland will meet with you to review your surgery. He will be able to address any of your concerns. Or anaesthetist, I don't know what, the person that knocks you out, will meet with you prior to surgery. You'll be given the anesthesia, and that is the most appropriate for you. Knock me out, mate. After surgery, driving. Do not drive during the first week to 10 days after. Well, that's interesting. I drive, but I don't have a car. Keep your wound dry for at least 2 days after your operation. Wounds are waterproof after this time, but do not soak in a bath or use bubble bath or soap on the wounds. A shower is best, after which the wounds can be damp dry with a towel. So I don't know why I just did that. You are advised to limit your activities to avoid unnecessary bleeding. Avoid strenuous exercise. Oh, I think I can manage that. Discomfort and tiredness. Moderate discomfort is to be expected. You can expect your most discomfort the second night and third day after surgery. Listen to your body. You have experienced a major surgical procedure. Rest when it tells you to rest. Oh, excuse me. You will be given a course of antibiotics to combat infection. Do complete the course. No alcohol should be taken for 48 hours after surgery. We discourage smoking for 48 hours at least. Do not use any why can't I speak? Do not use any electrically operated machinery or appliances for the first 48 hours after surgery. Just as well, I shouldn't be operating anything now by the sounds of it. Do not take on any serious decision making for 48 hours. Right. Should I press the button? Should I not? Should I take out a loan? Should I not? Okay. Continue taking on Nika as instructed. Oh, that's the recovery doula. Do not sunbathe for 2 weeks post-operatively. Basically, don't take any antibiotics by the sounds of it. No vitamin E tablets or dietary supplements. So yeah, that's all like pretty straightforward, really. There's not too much questions I have with that, really. It's just the drinking bit, the eating and drinking. Just ask about my medication, but because of my condition, I've got not condition, but I've got MPHD. I've mentioned it before. Basically, I take one medication that I have that is like hydrocortisone and thyroxine, which are quite important. The hydrocortisone is the most important one, and I went to my endocrinology clinic. I'm going again in November, so I can just double check up on everything before my pre-assessment, just to But she gave me like a sheet of what they'll have to do regarding surgery, like I'll need a drip of it and just sort of stuff like that. But it's pretty straightforward, and I can't be the only person that's ever they've come across that needs additional drips of sort of stuff. So yeah, that's pretty much the situation. Obviously subject to change. You know, they can delay it or whatever if there's a problem along the line, but that's sort of out of my hands. But yeah, I have a date. You know, New Year, nice exciting new start. You know, my birthday's in April, so that'll be awesome. You know, hopefully, you know, I'll be kind of sort of recovered by then. You know, nice. I can start looking for work finally, and yeah, it's just, you know, 2018 is going to be the year. So yeah, I'm just super looking forward to everything. You know, it's going to be like a slow sort of couple of months, but it'll soon whiz up, and before I know it, I'll be like, you know, I'm sort of, I don't know where I am with who's come in and all that sort of thing, so that's definitely something I've got to sort out. But first I need to know how long I'm going to be in there for, which is the main sort of concern, I guess. But yeah, other than a couple of little questions, it's all gravy, and you're happy, aren't you, Bubs? Yeah. Give me a kiss. Okay. He's happy for me. He's oh, shoot yourself. Yeah. So anyway, guys, thank you very much for tuning in. I hope that all is good with you. And yeah, I'll update you guys again soon. Because this is my 16th month on T, so around the 21st, 22nd will be like officially dead on, sort of 16 months. So I'll do a nice little recap video, which I've sort of started working on already. Because I didn't really do one for the year. I didn't do like a proper sort of. I did a little 12-month one, but yeah, I didn't do like 14 months or whatever. So yeah, I'll do a little update video for that and see the changes. For watching, I apologise about the bad lighting, by the way. I'm recording this one a bit later on in the evening, hence Gecko's being awake. Yeah, so the lighting's not great. I always record this off my laptop. I do really want to get a nice sort of video camera so I can get a decent picture, but it's just the monies. I've got no monies. So yeah, anyway, that's by the by. Alright guys, don't you jump. Don't do it. Alright, comment says bye. I say bye. Take it easy. Peace.